We've got a lot of weird for you. We've got 7 weird ways gluten can manifest. We'll be talking about blood pressure medicines that can cause celiac disease as well as Skittles. So stay tuned and we'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Hey, welcome to the Dr. Osborne Zone. Today we're going to be talking about 7 weird ways the body can react to gluten. So let's dive in. The first we're hearing a lot about in the news. You're hearing a lot about myocarditis right now going around everywhere as a result of the disease that shall not be named and the treatments being used for it. But one of the ways the body can react to gluten is something called cardiomyopathy, which basically is a fancy way of saying the muscle of the walls of the heart become inflamed and diseased. And so we're certain gluten can cause this. So let's check out some of the research on the topic. So in this case, you got a case report from BMJ. We've got a 57-year-old man. You can see after starting a gluten-free diet, his cardiac function improved markedly with ejection fraction reaching 70%, allowing his cardiac medications to be withdrawn. In essence, going gluten-free, he was able to get off of his heart medications. So again, this case suggests a link between celiac disease and cardiomyopathy. Then we have this report here, as you can see here, cardiomyopathy associated with celiac disease. We describe a patient with celiac disease associated with cardiomyopathy whose cardiac function improved substantially after treatment with a gluten-free diet. I think I'll pause there just to iterate this. So this is very important because so many people get a diagnosis of celiac disease, and but very, very few people get a diagnosis of cardiomyopathy and are told to go gluten-free. So when you get the diagnosis of celiac, you're told gluten-free diet's the right move. But how many of you ever had a cardiologist talk to you about gluten? I would doubt anyone's hands were raised in the digital room today because it's just not a common way that we see gluten manifest. It's not super common, so not a lot of doctors are aware of it. But again, in both of these studies, you can see cardiovascular function improved with the withdrawal of gluten. And so they go on to say cardiomyopathy associated with celiac disease is a serious and potentially lethal condition. This is one of the reasons why unrecognized gluten sensitivity is so dangerous. It can kill you. However, with early diagnosis and treatment, a gluten-free diet, cardiomyopathy in patients with celiac disease may be completely reversible. Okay, let's check out this last one. So you can see here, celiac disease associated with autoimmune myocarditis. So 5 patients with myocarditis and heart failure received immunosuppression and a gluten-free diet, which elicited recovery of cardiac volumes and function. Their conclusion: a common autoimmune process toward antigenic components of the myocardium, in other words, your immune system's attacking the heart muscle and small bowel, can be found in about 4% of patients with myocarditis. That means of all the people that get a myocarditis diagnosis, around 4% of them, according to this research study, have a gluten-induced autoimmune heart disease. So going gluten-free in 4% of these patients could very well save their life and help them recover from lifelong detriment as a result of not understanding the connection between gluten and cardiomyopathy. So if you know somebody with cardiomyopathy or myocarditis rather, let them know. Share the knowledge. Let's talk about symptom number 2, and that's skin rashes, particularly eczema. Eczema has been shown to be linked to gluten in numerous research studies. Let's check out this systemic review of the medical literature published in Dermatology Online. And you see here the number of different studies listed, and I'm not going to read this entire slide to you, but check this out. We've got non-celiac gluten sensitivity. So again, this is in people without celiac disease but with gluten sensitivity. again, non-celiac gluten sensitivity, improving and seeing their skin improve as a result of going on a gluten-free diet. And so you can see a number of different diseases. Erythematous, excoriated papular-vesicular itchy lesions similar to a subacute eczema or dermatitis herpetiformis, likely represented early manifestations. You can see hyperkeratotic scaly lesions, overlying erythematous infiltrative lesions resembling psoriasis, likely represented later lesions, etc., etc. Let's get to the point, right? Lesions disappeared 1 month after a gluten-free diet. That's amazing when you consider the quantity of people that go to the dermatologist with eczema and other inflammatory skin lesions and get pumped full of steroids and get pumped full of creams, right? And, diet is very, very rarely discussed. As a matter of fact, the vast majority of people I've seen in my clinic over the years, I can't recall a single time where a dermatologist has talked to one of them about how diet might be playing a role with the skin inflammation. As a matter of fact, it's quite the opposite. Usually it's diet has nothing to do with your skin rash. It's an inflammatory problem. We need to treat it with steroids. It's the typical that we see. Now, down here you can see 18% of patients had an associated dermatitis, 29% had an associated skin rash. Symptoms occurred in 95% of non-celiac gluten-sensitive patients every time or after gluten ingestion, meaning the rash came back repetitively when they were consuming gluten. Most commonly within 6 hours of ingestion. 25% of these patients had a positive anti-gliadin antibody test. And then we have here in this other study, 33% of patients had eczema or skin rash, and antibodies to gluten were present in over half, 56.4% of patients. This next study, 65.6 had cutaneous manifestations, eczematous dermatitis, 45%, atopic dermatitis, chronic hand eczema, psoriasis form dermatitis, and generalized eczematous dermatitis, urticaria, angioedema, generalized itching 10%, and psoriaform lesions in 9%. So again, more than half, 65.6, had cutaneous manifestations of gluten exposure. Again, these are people without celiac disease, non-celiac gluten sensitivity, manifesting as skin inflammation. In this last study, same thing, non-celiac gluten sensitivity, 40% experienced symptoms of eczema and or rash. So you've got rashes, eczema, out the wazoo with exposure to gluten. So down here, kind of a summary: gluten, right? Non-specific dermatitis and skin rash, eczematous dermatitis, urticaria, angioedema, and psoriasis form lesions. So if you've been diagnosed with psoriasis, eczema, atopic dermatitis, or angioedema or urticaria, you need to ask your doctor to rule out gluten as a primary driver. Not rule out celiac disease, rule out gluten, because as you can see in every single one of these studies, they were studying people with non-celiac gluten sensitivity. And so there's a distinct difference. Remember that celiac is diagnosed through a biopsy. People with non-celiac gluten sensitivity have negative biopsies of the small intestine. So if you ask your doctor to rule out gluten sensitivity and they test you doing a biopsy, you get a false piece of information. You always want to make sure, what I would encourage you to do is ask your doctor to perform genetic testing coupled with serum testing, so antibody testing, those two. But genetic testing is the most important. That's where I would start, and then you might additionally go on to serum testing. But this is the way you're going to help identify the non-celiac variety of gluten sensitivity and its manifestation in the skin. Okay, let's go to the next one here. Let's talk about infertility. This is a rising problem. We're seeing more and more couples having to use fertility services to have children. And the problem with that is infertility services lead to birth defects. They lead to multiple births, so twins, triplets, etc. They lead to malnourished babies and more risks, increased risks of birth defects. Why? Because when the body is malnourished and being damaged and has an inflammatory endocrine problem causing infertility, the body doesn't want to get pregnant. So if you force that with infertility treatments, you can really get into trouble in terms of the health and the outcome of the pregnancy. So it's important, if you're struggling with infertility, before going and opting to have thousands of dollars of in vitro and other types of treatments, you really should be looking at gluten as a potential reason as to why you might be struggling. And there are a lot of reasons why gluten can cause or contribute to infertility. Of course, one of the big reasons is malnutrition. So vitamin and mineral deficiencies are notorious for creating a difficult time or a challenging time with fertility. I mean, I've done an entire show on fertility. If you want to go back and look at our archives, you can watch that and get more of the detail. But what I've got here, just a research study on the gluten-free diet for infertility. So what you can see here is unexplained infertility. Okay, it's accepted that women with unexplained infertility have 3 times higher risk of celiac disease compared to healthy women. This finding leads to the conclusion that a gluten-free diet as the only effective method of treatment for celiac disease is also important to improve fertility. I think it's in the research, I've seen it a number of different numbers, but one of the numbers I've read is that more than about 4.5% of unexplainable infertility is actually being caused as a result of gluten. So there's a huge chunk of folks out there that are really struggling with fertility issues as a result of gluten-induced endocrine dysfunction or hormone dysfunction. So you definitely, if you know somebody struggling with fertility and trying to have a child and they can't, make sure that you share this with them, because this might be the thing that sends them on the right investigative path with their doc. Let's talk about the next one, joint pain. Okay, what joint pain? This is something I see probably more common than anything else, but we've got a lot of different diseases that are joint-based diseases that can be caused as a result of gluten exposure, and I've seen, this is especially true of autoimmune, right? So autoimmune diseases like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and then there's some of the more rare ones like dermatomyositis and other myalgias, polymyalgia rheumatica, fibromyalgia. These are largely associated with gluten. I can't tell you, I've seen thousands of people with these problems go into remission without drugs as a result of changing their diet. And gluten is a major, major player here. And this is one of the premises behind the book, No Grain, No Pain. So again, some of those of you who've been following me for a while know that's kind of, my claim to fame, if you will, is my international best-selling book, No Grain, No Pain, featured as a PBS special a number of years ago. But it's a major, major breakthrough in people that struggle with autoimmune pain situations where they're forced on these drugs like biologics and methotrexate and severe doses of steroids and other non-steroidal anti-inflammatories. And the path forward on those drugs is it's devastating, because the drugs are very, very taxing on your overall health and longevity. So if you struggle with an autoimmune form of arthritis, joint pain, you definitely want to check out gluten as a cause. Most rheumatologists will not make that connection. I can promise you that. In 21 years of practice, I've never had a phone call from a rheumatologist whose patient I helped put into remission as a result of changing them to a gluten grain-free diet. So it's not common knowledge amongst the rheumatological community, and it should be. All right, let's talk about the next weird thing that can happen with gluten, and that's schizophrenia. A lot of people are like, how in the heck can gluten affect the mind and create neurological brain disease leading to diseases like schizophrenia? Well, there's several different ways. There's gluten, which is a neurotoxin, so it can damage directly the brain. And this has actually been really well studied. A group of researchers out of Oxford, UK, Marius Hadjivassiliou, they've been doing research on gluten as a neurotoxin for years, and very, very compelling and exciting research. And we also have gluteomorphin, which is a subtype of gluten that mimics morphine, and it can alter function and thought. We also have non-gluten related. This is what just interesting as a side note. We have ergo, which is a fungus produced toxin that creates hallucinogenic-like effects, and it's commonly, especially in days gone by, it was commonly found as a mold growing on breads producing this toxin. So a person eat moldy bread, they develop what was called bread madness. As you can see here, bread madness, right? So it was one of the older forms of mental disorder as a result of bread consumption. But I want to show you this quote from Dr. Peter Green, who's the director of the Columbia University Celiac Disease Center in New York. And this is a quote from him. An emerging group of people with gluten sensitivity have such psychiatric and neurological disorders as schizophrenia, ADHD, attention deficit hyperactive disorder, depression, bipolar syndrome, and a higher rate of antibodies. Schizophrenia used to be called bread madness. So again, alluding back to historically bread madness, it's important to understand that many research studies have found that people with schizophrenia, a large percentage of them actually have antibodies to things like gluten and dairy. And so what they're finding, and I have seen this clinically play out a number of times in schizophrenics, where they're reacting to dairy, they're reacting to gluten, you change their diets, and they can become stable. Now, I'm not saying that every case of schizophrenia is simply gluten-induced, but it definitely merits investigating. If you have a diagnosis or know somebody with a diagnosis of schizophrenia and they don't understand that there's a potential for gluten connection, you definitely want to share this information with them. Okay, let's move into the next weird symptom, and that is seizures. Now, I remember years ago, this was even before I wrote No Grain, No Pain, there was a special on the Discovery Channel. If you remember, there was a show called Mystery Diagnosis. And there was an episode, and I was watching it one night, and this was early on in my career, and I was watching the show, and it was a little boy who had epileptic seizures. And his mother was a celiac. So his mom had celiac disease, and the child kept seizing, and so she took the child to the pediatrician and through a number of battery of different tests and things. They actually figured out that the reason the child was having seizures was because of gluten. And the way the pediatrician figured that out is because the mom had celiac. And so in anytime you've got a relative directly, especially a mom, a child, uncle, an aunt, a grandmother, grandfather with celiac, the likelihood that you're reacting to gluten skyrockets. It goes through the roof. And so we know there's a huge familial tendency, but not everybody reacts to gluten, obviously, in the same way. And so whereas one person in your family might have celiac, other people in your family might develop things like seizures or schizophrenia or other weird symptoms of gluten exposure without actually being a celiac. So again, seizure is a major manifestation. I've seen this one quite a bit in clinic practice. So you can see here in this review study from the Journal of Neurology, gluten sensitivity and epilepsy, a systematic review. And I'll just go down here to the summary. Gluten-free diet is effective in the management of epilepsy in 53% of cases, either reducing seizure frequency, enabling reduced doses of anti-epileptic drugs, or even stopping anti-epileptic drugs. And now I just want to circle that, because that's what I have seen is the cessation or the discontinuation. I've seen people be able to get off of those medications once they change their diet. And why we want to get off those meds, what's important about that is that those meds reduce B vitamins. They actually cause B vitamin deficiency. Now, B vitamin deficiency, guess what that causes? It causes seizure. So what ends up happening is the longer you're on those meds, driving that B vitamin deficiency. In the end, the B vitamin deficiency is actually what can help drive the disease, making your doctor want to change or increase your dose of medication. So it's very, very important to understand that. And if you fall within that 53% of people with epileptic seizure disorder that can improve as a result of changing your diet, I mean, think about how life-changing that could be. Because a lot of people with seizure disorder can't drive a car. They can't function on their own in society because of that limitation. So this could potentially be life-altering. So if you know somebody with epilepsy, you know somebody with seizure disorder, you definitely want to share this information with them. Again, encourage them to get genetically tested for gluten. That's the best way to know whether or not you have that problem. All right, let's talk about tonsil stones. The last thing here, tonsil stones. You know, if you ever open it up and say, you see little white stones that form in the tonsils. Those are accumulation of white blood cell debris and pus that accumulate in the tonsils. They cause a lot of problems in terms of health. One of the problems that, you might not say, hey, this is not a big deal, but bad breath can be socially devastating for a person, right? And it's because, again, this is like pus. This is blood cell debris, and it stinks. It's very, very stinky, and it can contribute to severe bad breath. But more importantly, this area, the tonsil, right, it swells. And what happens is now, let's say you're exposed to virus, bacteria, or other microorganism that could potentially try to do harm. Your body is so busy, your tonsils are so busy fighting gluten that the immune system resources are directed away from combating things they should be combating because it's so busy fighting your food. And remember, the point of eating is to nourish yourself, not to create an immune challenge. This suppresses your ability to deal with environmental threats. And so tonsil stones are a symptom, again, that even if you have no other symptoms, this actually for me as a child was one of the symptoms that I had. I had recurring tonsil stones, could never figure out why. Mom would take me to the doctor. Nobody ever gave me a reason. But when I stopped eating gluten, this stopped within a week. I mean, it was gone. It was gone within a week. And I've seen this too in a number of patients where they have this recurring stone formation in their tonsils, and it's really creating a lot of problems for them in their relationships because nobody wants to stand near them. Again, that bad breath can be a very limiting social element. And so when they go gluten-free, boom, within a matter of weeks or a week or weeks, it's gone and it doesn't come back. And when they get exposure, boom, there it is. It's coming back again. So there you have it, folks. 7 weird ways that gluten can manifest without being celiac disease. If you know anyone with these 7 issues, share this video with them. I think together we can reach more people, we can help more people figure out whether or not gluten is playing a major role in their health issues. Hey, welcome. Today we're reviewing Nick Stick's original beef jerky. One of the reasons I chose this particular product to review is because if you're on a gluten-free diet, you've probably already experienced this. It is super challenging finding a good beef jerky that doesn't have some kind of wheat in it. A lot of the teriyaki sauces and soy sauces used to make jerky, when you go to the regular grocery store and look for it, they got wheat in them. So we needed to find an option that was wheat-free, that was gluten and grain-free. But the other problem with jerkies is they oftentimes contain chemical preservatives, the nitrates, terrible for you, bad for your health, a condition or a precondition to a risk factor for the development of different types of cancers. So we wanted to find a clean jerky meat that was simple, tasted good, that you could travel with, and convenient. And so here we've got, again, Nick Stick's original beef jerky. Comes in packages, pretty easy to tear open, no struggles there. I didn't need scissors or a knife. It came right apart. And so let's now give it a go and see what happens. Yeah, that's super good. It's not too salty. A lot of times jerky's super, super salty. This stuff's not too salty. It's not too crunchy or chewy. You know, some jerkies you get stuck in your teeth and you've got to work the jaw over just to get them down. This is actually the perfect blend because the texture's really good. It's not too, like I said, not too terribly chewy and not too terribly salty. 100% grass-fed meat in this stick. So this is a solid performance. Again, this is Wenzel's Farms Nick Sticks grass-fed beef jerky. Ingredients are pretty simple here. You've got grass-fed beef, water, seasoned salt from Redmond's, and then some mustard, some coriander, celery, black pepper, paprika, turmeric, as well as celery powder. So solid list of ingredients, no major preservatives, no gluten, which is the most important factor. And this is one you could eat at lunch. This is also one you could travel with, right? You could carry it in your backpack. You could carry it in your suitcase. You know, wherever you're going, if you're in a bind, pull it out. You've got some protein with a little bit of fat. Perfect. Highly recommend you check out Nick Sticks. They get my thumbs up of approval. In this week's episode of PharmaHarma, we're going to talk about a class of medications called ARBs. That stands for angiotensin receptor blockers. I'm going to put these up on the screen so that you can record it and know what drugs are ARBs. So let's put those up for you. Atacand, Avapro, Benicar, Cozar, Diovan, Micardis, and Tevatine. In parentheses, we list the generic name of the medication. So again, pause and take that screenshot if you want to go through those. But why are we talking about ARBs today? Well, one of the reasons why is these drugs are commonly prescribed for people that have high blood pressure. It's one of the more commonly prescribed class of medications. And so 874 million people with high blood pressure globally, that stands to say a lot of folks are going to be on these types of medications. So why is that important to understand? Because research studies now are showing that this class of drugs can cause gastrointestinal inflammation and damage that looks exactly like celiac disease. And so what that means for you, if you've been diagnosed with celiac disease, maybe if you're taking one of these medications, the damage was caused by the drug and not gluten. So it's possible you might not be gluten sensitive and that you might just be sensitive to the medication. But why else is this important? Now, side effects of this class of medication, we'll put up on the board on the screen for you, include dizziness, headache, drowsiness, nausea, vomiting, diarrhea, cough, elevated potassium levels, which is a big danger, low blood pressure, muscle and bone pain, as well as skin rashes. Not a pretty list. But beyond that, why is this important information to understand? Look, these drugs cause intestinal inflammation that can look just like celiac disease to your doctor. So if you've been taking these medications, short-term or long-term, studies show that it's not just an acute side effect. You could be on this drug for 5 years and start developing diarrhea, go to the doctor, and they could diagnose you with celiac disease and be wrong because, again, the drug's side effects can mimic the damage that celiac disease manifests with or that gluten can cause. So it's very important that you understand these drugs can cause identically what looks like celiac disease. Now, if you look at what I've got here on the screen, this study was published in 2012 by Mayo Clinic Proceedings. And the conclusion of the study was that the drug olmesartan is associated with a severe form of sprue-like enteropathy. Let's make that sound like normal English. Basically, olmesartan can cause damage that mimics celiac disease. Now, since this study was published in 2012, there have been 107 more studies and case reports in the medical literature on the same thing, but it doesn't stop at that type of medication. You can see in this next research study, telmisartan was also shown to cause sprue-like enteropathy. You can see in this next study that iprosartan also can do it. So you've got multiple classes of ARBs, angiotensin receptor blocker medications, have been shown to, again, emulate or mimic the intestinal damage that celiac disease represents. Now, if you look at this study published in 2021, it's actually a research study showing that patients with celiac disease, properly diagnosed celiac disease, who are taking these medications don't heal as well. And I quote, check this out, celiac patients who take ARBs are more likely to have persistent symptoms and lower rates of mucosal healing than their age-matched celiac controls. Why is that important? Because if you are gluten sensitive and have celiac disease, but you're on this blood pressure medication and you're not responding to your gluten-free diet, that's a problem, right? Because it could be the medicine that's causing it. And when patients don't respond to a gluten-free diet, doctors label that refractory celiac disease. What does that mean? That means you don't respond to the diet. And what's the treatment for refractory celiac disease? It's high-dose immunosuppressant drugs and steroids, which come with their whole list of side effects and problems as well. So you don't want to get sucked into that vortex of drug-induced problems. So again, if you are celiac or gluten sensitive and you're not responding to your diet and you're taking one of these medications, you definitely want to be aware that the medication may be contributing to the persistence of illness that you're experiencing. Hey, this week we've got a great story for you. Reuters reports that Skittles are toxic, right? And so there's a new U.S. lawsuit. It's actually out of California, where a company is suing the manufacturer of Skittles candy because of the additive ingredients, particularly in this case, an ingredient called titanium dioxide. Now, what is titanium dioxide? It's a powder derived from elements in the Earth's crust, but it has been shown recently in research to contribute to DNA damage. It can damage the way the DNA replicates, and in the European Union, they've now banned this food additive for the risk and fear of causing human cancers. Now, if we look at Mars, check this out, I'll put it on the board. Back in February of 2016, Mars, the company that produces Skittles, vowed to remove artificial colors from its food products over a period of 5 years. So they gave themselves basically 5 years to get all this nonsense out of the food. My question is, why the hell was it ever there in the first place? What do they need to put poison in your children's candy for in the first place? But nonetheless, they vowed in February of 2016 to get it out. Now, in October of 2016, Mars confirmed that titanium dioxide was among the colorants that were going to be removed from their candies. Now, titanium dioxide is also used in these things. Check this out. It's used in other foods. It's used in supplements, so you got to watch out. If you're buying supplements, you definitely want to avoid this stuff. It's used in sunscreens, paints, adhesives, plastics, and roofing materials. Again, it's been linked to causing DNA, brain, and organ damage, as well as lesions in your liver and kidneys. Now, in Europe, titanium dioxide was banned this August, so it's no longer allowed there for health concerns. Now, I want to show you this last thing. Let's put this up on the screen. This is a research study published in the journal Bionanoscience in 2021. You can see here titanium dioxide nanoparticles are the most produced nanomaterial for food additives, pigments, photocatalysis, and personal care products. High usage in such a way has increased the toxicological consequence of the human population. Moreover, titanium dioxide nanoparticles primarily cause adverse reactions by inducing oxidative stress that leads to cell damage, inflammation, genotoxicity, and adverse immune responses. And so for that I say, thank you for suing Skittles. Get the garbage out of our food. We're done with it. We're tired. Quit hurting and injuring our children. We live in such an ass-backwards society where these things have been allowed to propagate and go on for far too long. So thank you for bringing some common sense to this world we're trying to navigate.
Okay, Doc, today's question is, are you a morning person or a night owl?
I gotta say, I'm definitely a morning person. 5 a.m. is 5 to 7 is like wonderful time. I get to be left alone, not bothered, get a workout and have thoughts in my head that are non-interrupted by others. So definitely a morning person for that. And I'm an old man as it relates to bedtime. So I mean, 8:30, if I'm not in bed, I'm getting cranky. So I like to go to bed on time. I like to wake up on time. As the cliche says, the early bird gets the worm. That's me. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this. And make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.